Welcome, everyone, to another episode of the Health Made Simple show. I'm your host, Dr. Bart. Today, we're going to do a deep dive on high blood pressure. So, this is a conversation that I think often gets overlooked in almost always. We've almost just taken for granted. If you have high blood pressure, this is what you do. You go on a medication or you watch it over time and see how it does. And then eventually that leads you to medication. And we just generally accept this. And we look at this and go, oh, I guess it's hereditary, or we don't really know why it's there, or it's just that time of life, or whatever it may be. Today's podcast is to kind of push that conversation back and really take a little bit of a deeper dive and look at blood pressure. What are the three primary causes? And I'm going to kind of throw a fourth one in there as well. What are the three primary causes? What, if anything, can we do about it? And listen to me here. Some of this might sting a little bit, especially if you've ever been diagnosed with blood pressure, or if you're one of the practitioners out there using medications as your primary tool. I understand this is going to sting, yet nonetheless, kind of hear me out. And of course, do this best you can. Anybody you know, which is going to be a lot of people, frankly, that have high blood pressure, that have been diagnosed with it and might be even on medications, share this with them, because there's always options, especially if you're willing to put a little bit of work in. With that being said, none of this should be construed as medical advice. Always see your doctor when it comes to your health concerns. This is just information for you to potentially use down the road when you want to become the best version of yourself. All right. With that being said, welcome back to another episode of the Health Made Simple Show. I'm Dr. Bart. I'm going to help you walk through what I think is one of the most overlooked and maybe one of the simplest things to solve out there, and that is what we call high blood pressure. All right, let's dive into a couple of things first. How common is high blood pressure? It's unbelievably common. 1 in 2 adults have what's called hypertension. Hypertension is when we have high blood pressure. That's a fancy name of saying you have high blood pressure. If you're over the age 65, 75% of the population over 65 is on blood pressure medication, lowering medication. That's a problem, folks. That's not normal. And here's why this is a problem. Because here's why. Here's the punchline. That the number one killer in our country is still cardiovascular disease. So which means over 700,000 people every single year are still dying from heart issues, cardiovascular disease, which means that our practice of trying to keep our hearts healthy isn't really working. I told you some of this is going to sting. With that being said, there's other options. And understand this, that one of the biggest reasons it's not really working, and then we just look at the results, 700,000 people dying every single year from heart disease. And all of that starts with probably the simplest place it always starts with isn't the all of a sudden this person just has a heart attack, and those things do happen, yet it usually starts with hypertension somewhere along the way, meaning high blood pressure, either diagnosed or undiagnosed, because sometimes there's no symptoms to it. But either way, that's where it starts. It's almost like the training wheels. And then if we're told in the beginning, oh, you have high blood pressure, therefore we must make it low, and we go on a blood pressure lowering medication, often that's where the troubles begin. All right. So with that being said, let's reverse engineer this, and hopefully this podcast leaves you in a confident, informed situation where you then can make better decisions down the road. And let's start with this. Let's start with, how should we be taking blood pressure? And are there situations where maybe you've had your blood pressure taken that was inaccurate, and you should go back and check it again? Real simple. I'm not going to go through all the steps, but ultimately it looks like this. Let's say you go into your doctor's office, or you go down to the local pharmacy or whatnot, get yourself a blood pressure medication, which I do recommend. I have one at home. I have one in my office. I think it's a good measuring stick. It's good data for us to have, especially if you have zero symptoms. Just check your blood pressure. Let's see what's going on. Just like getting on a scale, it doesn't lie. And then we make modifications. We take action to see how to improve these things. All right. That being said, you should be sitting down calmly, without your phone in your hand, without anything else going on, kind of a stress-free environment, for at least 5 minutes before you take your blood pressure. And for that reason right there by itself, we know that most blood pressure tests are inaccurate, because oftentimes you're going to your doctor's office and you take blood pressure while you're in the office. And most of us will experience a little bit what we call white coat syndrome, which just the fact that we're being tested, it kind of stresses us out a little bit. And as a result of it, we see our blood pressure go up, especially that top number, which we consider the systolic. That's the one that moves the most relevant to your day-to-day stressors. You have stress, it goes up. You have, you get a little more calm, it goes back down. And I'm going to give you some clues here today and how to, really significantly change that gives you a little more confidence in saying, man, I probably can control the state of my blood pressure. With that being said, let's discuss, or at least address, the issue of it being what a lot of people think is genetic. They get diagnosed with blood pressure elevation, hypertension, and first thing they hear is, well, your daddy had it, your grandpa had it, your neighbor, your dog, your cat, whatever. Someone else had it, and therefore that's what it must be. It must be genetic, and therefore it's just your time, and now you have it. And let's just go on a little medication and lower that down. I'm gonna encourage everyone when I say that kind of jokingly, because I want you to kind of double think that one. Most of the time, probably less than 5% of the time, is your blood pressure going to be directly correlated to your genes. Do they have an impact? Absolutely they do. Yet almost always, 95% of the time, is going to be what we're doing with our lifestyle. They're the things that we're going to discuss today. So if you have the same lifestyle as your mom and your dad and your grandpa and all those other people, then most likely you're going to get the same type of results. But if you want to change those end results, we got to change what we're doing. So with that being said, most of the time it's not genetic, even though that's the simple, most commonly, that's exactly what I hear from my patients. And so for men and women out there practicing like I do in the world of functional medicine, my license is in chiropractic, I have a license in acupuncture, practice functional medicine, functional nutrition. We see a tremendous amount of people that are on blood pressure medications. And what it tells us is that we've skipped over the root cause. We've skipped over the conversation of, well, why do we have these elevated blood pressure readings? What's going on there? And roughly, if I haven't mentioned this already, roughly, and everyone's a little bit different depending on what age, body size, shape, male, female that you are, about 120/80 is kind of the standard. And for everyone, there could be just a little variation from there, but that's the basic bench line. All right, so let's get into these three different things. And then, of course, you're going to keep doing your thing, keep sharing out, keep spreading out, because this to me is the training wheels. Once we have that diagnosis of high blood pressure and we leave it by itself and we don't address these root causes, that's when trouble ensues. All right, with that being said, problem number one, and all three of these will intertwine and probably affect each other. And there's kind of a fourth I'm going to share. So number one is this: is nutrient deficiencies and toxicities. I'll go farther and say that the nutrient deficiencies and toxicities are the root cause of all diseases, all of them, every single one you can think of. At some point, start with a nutrient deficiency and or a nutrient toxicity, something coming into the body, creating toxicities in the body. The two most common nutrient deficiencies, especially when it comes to heart-related issues, are magnesium and B vitamins. Folks, I can't tell you how many times that we've helped with arrhythmias, we've helped lower blood pressure medications simply by putting people on higher levels of magnesium, even those that are on it. I mentioned a moment ago that 75% of people over 65 with hypertension are on blood pressure medication. 75% of the adults in our country over 65 are on blood pressure medications. That's awful. Many of these people, because over time, their ability to absorb nutrients and their ability to put the right nutrients into their body are both deficient, things like magnesium become deficient. And magnesium is phenomenal for the body. It's just a mineral, and one of its primary properties is to create vasodilation, where we take pressure off of the actual artery or vessel, and we start to let it expand so your blood pressure normalizes. This isn't the fix for everyone. I'll tell you, almost always magnesium is part of it. And frankly, as you get older, you probably need more magnesium than when you were younger. And there's a lot of good kinds out there. I typically use something called magnesium lactate. It's one of my favorites. There's a lot of good ones out there. Not too many not so good ones. I typically encourage people to avoid things like magnesium oxide and some others that are kind of highly processed, not so easy for the body. So the nutrient deficiencies and toxicities are one of the primary causes of blood pressure of higher blood pressures. I'm going to move forward from there and just talk about a couple other things. The next one that I want you guys to recognize is that often, let's just say that you balance it out. You get some magnesium in your body, you get some B vitamins. I specifically use something very specifically when people have high blood pressure. It's called Cataplex B2. It too is a vasodilator. So I'll use two nutrients, one vitamin and one mineral. This is how easy sometimes it is, folks. I'll use a vitamin and a mineral, very safe, very gentle for the body, very inexpensive. and I will have them take it for a couple days. Some breathing instructions go with it, and have my patients start to measure the blood pressure at home. More often than not, their blood pressure starts to come down within the first day, never mind days. And this then all of a sudden gives the patient this aha moment of, wait a minute, wait a minute. Maybe this wasn't my genetics. Maybe this is something I could control. Maybe this is something that I could play a role in lowering this if I get to the root causes, nutrient deficiencies and potentially toxicities. So let's talk about the toxicities, because this is, so number one, nutrient deficiencies and toxicities. Number two is liver stagnation. And what that means is basically liver getting toxic. And there's a couple of ways we can test this, but this is what happens, folks. When we bring toxins into our body, and anything from what is a toxin, anything that didn't come from God's garden, whether it be a medication, whether it be processed food like canola oil or these sugars and all of these things that create inflammation within the body. Think of it for a moment. If you have inflammation, I don't know, around a joint, what happens? The joint swells and we increase the pressure in that area. Very same thing happens to your cardiovascular system, especially your arteries. When we eat sugar, when we eat things that are damaging our body, processed foods, they scrape the inside lining of the arterial wall and it starts to swell. And as a result of that, it decreases the amount of space that the blood can flow through. We can measure certain things like your C-reactive protein, that's a lab test. We can measure things like homocysteine levels, and we start to get inclinations that you have an inflammatory process taking place on the inside of your arteries. If this is the case, your blood pressure is going to go up. Then what are the subtleties that we do? We start to clean up the diet. You get the sugar out of your diet. You get that poison, that liquid poison that we call alcohol, out of your diet. And what happens? What happens in more cases than not? You get the sugar out, you get the alcohol out, you get the processed foods out, and we see the blood pressure start to lower. So if this was the instructions, instead of, here, take this medication, take this drug, we would then get to the root cause, and that would start to playing the role in us decreasing the amount of people dying every year of cardiovascular diseases. Because remember, the high blood pressure is almost like the first thing that's going to happen. It's an inclination that your body, man, we're working harder. Something's not right here. We're deficient and or we're toxic. So number two is liver stagnation. In clinic, we have a very simple test. I'll test someone's blood pressure, have them sit there as long as they possibly can. We try to get to that 5-minute mark. And I know a lot of times we're in a rush. We don't always have time to spend 5 minutes. That's why I encourage everyone to make sure they have a blood pressure cuff at home, where they're going to have more time than their doctor's office. But right in my office, I can do that. One of the ways I test to see if it is liver stagnation is I have them chew up a supplement we use called Antranex. Antranex is essentially, it's again, a whole food source that's going to help drain the liver. And what this does is it takes pressure off the liver. So in that moment, if we get pressure off of the liver and the liver can start to drain, it has more capacity to handle all this stuff that it's dealing with, oftentimes we'll see that the blood pressure lowers immediately. Now, typically, this number two, so number one was nutrient deficiencies and toxicities. Number two is liver stagnation. These are the causes of high blood pressure. If there's a number two here, and we all of a sudden give the body something to help essentially ease the pressure, ease the work that the liver is doing, and that lowers the blood pressure, typically it's also involving number one, because that means we're bringing stuff into our body, toxins that are impacting the liver in a negative way. Which means, again, what does this boil back down to? The cool thing is this boils back down to lifestyle. And if we can stop the bad guys from coming in, increase the good guys coming in, and help support our liver a little bit, phenomenal. The product I use typically to do exactly what I just said there, to drain real quickly here, is something called Antranex. And again, this is not doctor's advice. Make sure you see your functional medicine doctor, et cetera, or whatever doctor you choose to help you with your blood pressure issues. I would encourage you to always see if you're getting to the root cause. The way we typically do this in clinic is I'll have you chew them literally while you're in my clinic, while you're sitting on the table. I have you chew about 4 or 5 of them, and about 2 to 3 minutes later, we test. And it is not uncommon that if there's a liver stagnation, we will see a change in your blood pressure that fast, which is pretty cool. All right, let me lead into number 3 here. Number 3 is this. So let me go back up to once I see that, then I say, all right, one of the simple things we're going to do the best we can. We're going to clean up the diet, stop the sugar, stop the processed food, try to get that liquid poison out of our life, or at least, definitely decrease it. And then also add some milk thistle. Milk thistle is one of those beautiful herbs that's been around forever. We know that it helps restore any liver damage or any damages that might have been taking place in the liver, but also it helps us clean things out, which is wonderful. So milk thistle, little Antronex, phenomenal little sources there. Last but not least, and I think this one's overlooked quite a bit, and that is posture. Yes, literally our posture that we have. So imagine if you have someone that is a little bit nutrient deficient, a little bit toxins coming into their body. Maybe they're eating, they're having a coffee while they're sitting at their desk and they're at work 8, 9 hours a day. Coffee, by the way, is a vasoconstrictor, so it certainly can increase blood pressure. And then you have things like maybe a little bit of a muffin or a bagel or some type of starch or carbohydrate that turns into sugar. So we have an inflammatory process taking place in our arteries, in our veins. And now, so we have inflammation, which creates vasoconstriction, coffee vasoconstriction, and then we sit down and now we compress the organs and we're not moving, so we don't have really good circulation. We're not letting our muscles assist our heart in getting circulation to and from the heart. So this is what's probably the most overlooked, and there are some clinical tests that we use to determine what's going on with your blood pressure. Is this an adrenal effect, et cetera? There's a test called Ragland's test where we show that your posture plays a huge role on what's taking place in your blood pressure. And real quickly, we test your blood pressure while you're actually lying down. And inevitably, when you're lying down, it's just easier for your heart to circulate, right? So you're not against gravity as much. So we take your blood pressure, immediately stand you up and take your blood pressure again. Naturally, in a healthy, functioning heart, that blood pressure will go up about 7 to 10 points. Perfectly fine. If it goes up much more than that, then we know we have some issues. Typically, that means your adrenal glands, your stress glands are overworking. If it doesn't go up at all, it often tells us that your stress glands aren't working that well at all, which is more of an adrenal issue. But both of those are considered nutrient deficiencies and toxic situations going over long, chronic periods of time. So the three things here today, and we're going to wrap this up and talk a little bit about stress. Nutrient deficiencies and toxicities, probably the single most root cause of all high blood pressure situations are because nutrient toxicities and deficiencies, magnesium, B vitamins, liver congestion. How do we test that? There are certain things we use in our office, like things like Antronex, which is, I'll make sure that's in the show notes for those of you who want it. I have people chew them up, retest. We figure out if there's a liver involvement here. If so, milk thistle, every one of us having a little bit of milk thistle a couple times a month would be absolutely fantastic practice. We know that we're exposed to a lot of toxins. And last but not least, posture. If you are sitting at your desk, even folks, if you are someone who exercises an hour a day, yet you have a tendency to sit for hours upon hours, day after day, week after week, month after month, inherently, you are most likely going to make it harder and harder for your heart to do its job, which is to pump pump your blood, your oxygen through your arteries down into the body, and then bringing it all back through the veins. If we sit a lot, we will see inherent elevation of blood pressures. And I think that's part of what we see with the aging population, that they're less active. So talking about some other things that are going to influence this. The big one that I didn't discuss is stress. What is the role of stress in all of this? Everything gets worse. We know that stress is a vasoconstrictor, meaning it creates a pressure, it pushes down on the arterial wall, it vasoconstricts, and as a result of it, the pressure on the inside goes up, folks. That's what hypertension is. If we have natural stressors and the ability to unwind from them, that little fight or flight that kicks in, awesome, elevated blood pressure, and then shortly after that, it should back down. It should calm, be at ease, and relax. Unfortunately, in today's environment, we see so many people so wound up so consistently because of how they eat, how they move, and how they think, all the different chemicals coming into the body. More often than not, I'm finding people that are just stuck in sympathetic dominance, which is a fight or flight. So a couple of quick remedies here. So stress will make problem number one, which is nutrient toxicities and deficiencies, make that worse. It'll make liver congestion worse, and it'll certainly make your posture worse. Now imagine sitting at your desk, stressed out, just sitting there, sucking back coffee, not eating really good food, having sugary snacks through the course of the day. You're bound to create some hypertension. So with that being said, let me give you some simple solutions here. And again, not to be doctoring advice, this is certainly something you want to check with your healthcare practitioner of your choice. But here's some things that could just help in general. One, learning how to breathe better. And when I say breathe better, it's not about taking necessarily a big inhale It's really about a slow exhale. If you can control the exhale, long, slow, deliberate exhales, you can control the state that your body's in. What's kind of fascinating is that you can't be stressed and exhale slowly at the same time. That's one of the first practices. If and when you choose to go get yourself a blood pressure device down at your local pharmacy, wherever you want to get it, go home and test it. You always want to test it in groups of 3, meaning you're going to test it 3 times. You're going to test it, take about a minute or 2 of slow breathing, focusing on your exhale, test it again, and start to log these down. In the beginning, I recommend you do twice a day. So you might see that you might have these changes at different times of the day. And that would give us some indication that some of the root cause of your high blood pressure might be caused by some of the lifestyle things you have during the day. Could be work, could be morning stressors, whatever it may be. That is a phenomenal practice for it. And I'll also encourage you this. If you've been diagnosed with high blood pressure, take just 3 days off of a sugar hiatus and that poison liquid stuff we call alcohol. And I know I'm joking. I know that stings a little bit if you're drinking alcohol and you think it's no big deal. It is a big deal, folks. It's always stressful to the body. It always stagnates the liver, and it always creates inflammation in the body. So it's a poison to the human body. Yet, so imagine getting rid of it for just 3 days, that and sugar, and measure and see what's taking place with your blood pressure along with these little tips. And I bet that you would be very, very pleasantly surprised on your outcomes and the results that you get. All right, folks, with that being said, thanks for joining us for another episode of the Health Made Simple Show. Keep doing a thing, keep sharing out, keep spreading love, and I'll see you in the next episode. You all be great.